Coronaviruses are a group of viruses belonging to the family of Coronaviridae, which infect both animals and humans. Human coronaviruses can cause mild disease, similar to a common cold, while others cause more severe disease. The coronavirus particles are organized with long RNA polymers, tightly packed into the center of the particle and surrounded by a protective capsid, which is a lattice of repeated protein molecules referred to as coat or capsid proteins. Causes includes close contact within 6 feet or 2 meters with someone who has COVID-19, being coughed or sneezed on by an infected person. Signs and symptoms of coronavirus disease may appear 2 to 14 days after exposure. This time after exposure and before having symptoms is called the incubation period. You can still spread COVID-19 before you have symptoms, which is called pre-symptomatic transmission. Common signs and symptoms can include fever, cough, tiredness. Early symptoms of COVID-19 may include a loss of taste or smell. Other symptoms can include shortness of breath or difficulty breathing, muscle aches, chills, sore throat, runny nose, headache, chest pain, nausea, vomiting. People who are older have a higher risk of serious illness from COVID-19, and the risk increases with age. People who have existing medical conditions also may have a higher risk of serious illness. After exposure to someone who has COVID-19, do the following. If testing is not available, stay home and away from others for 14 days. While you are in quarantine, do not go to work, to school, or to public places. Ask someone to bring you supplies. Keep at least a 1-meter distance from others, even from your family members. Wear a medical mask to protect others. Clean your hands frequently. Keep the room well ventilated. Monitor yourself for any symptoms for 14 days. If you test positive for COVID-19 and are more likely to get very sick, treatments are available that can reduce your chances of hospitalization and death. Don't delay. Treatment must be started within days after you first develop symptoms to be effective. Medications to treat COVID-19 must be prescribed by a healthcare provider and started as soon as possible after diagnosis to be effective. Most people with COVID-19 have mild illness and can recover at home. You can treat symptoms with over-the-counter medicines such as acetaminophen, Tylenol, or ibuprofen, Motrin, Advil to help you feel better. There are 2 categories of COVID-19 vaccines: component viral vaccines and whole virus vaccines. Component viral vaccines. Protein subunit contains isolated and purified viral proteins. Virus-like particles. VELP contains viral proteins that mimic the structure of the virus, but no genetic material. DNA-based. RNA-based contains viral genetic material such as mRNA, which provides the instructions for making viral proteins. Non-replicated viral vector contains viral genetic material packaged inside another harmless virus that cannot copy itself. Replicating viral vector contains viral genetic material packaged inside another harmless virus that can copy itself. Whole virus vaccines. Inactivated contains copies of the virus that have been killed. Inactivated. Live attenuated contains copies of the virus that have been weakened. Attenuated. Vaccines are the best way to train our immune system to recognize viruses or pieces of viruses called antigens. Our immune system creates antibodies and other defenses to protect us. When a vaccinated person is exposed to SARS-CoV-2, their immune system will recognize the viral antigens and spring into action to keep them healthy. The best way to prevent COVID-19 is stay home and be safe.
Do subscribe the channel for more videos.